Well, my philosophy for looking after frail people, who are generally people who are homebound and who have difficulty doing things for themselves and need assistance with that, is that they get to choose the kind of care that we provide. So if they favor comfort over prolonging their life, if we have to choose between the two, we listen to that opinion. If they decide that they don't want to be on medication unless it's going to help them with their comfort or with their function, we respect that to the extent that we can. So I just think we are beginning to swing around to giving frail older people, or their families, if the older people can't choose, a choice, and respecting that choice. And it makes life much better for them, and it ends up making life easier for us too. It has to do with keeping people where they want to be, and where people want to be is in the sunshine. But it's a nickname for older people who are within the frail group that choose a less invasive, less medical model, less one-size-fits-all, less cookbook approach to their care, and they end up being on less medication, usually. They end up having fewer admissions to hospital, less trips to the emergency room, and if we do our job properly, they're happier, they live longer, strangely enough. This is staying at home as opposed to going to the hospital. And there is certainly a tendency for the system to save money, although, of course, we shrink from emphasizing that because that's not the primary goal. Person-based care or client-centered care is now a buzzword. And the sad thing is that for an awful lot of people, once you say it, you've taken care of the situation. But it's really, the reality is a long, long way from that. And you have to put the care in place that allows you to do what the person wants. An elderly person tells you that what they want to do is stay out of the hospital, for example. Well, that may not be so easy to do if they get sick in the middle of the night and you're not available in the middle of the night. So staying out of the hospital entails 24/7 availability of care at home. I think in 5 years' time, we're going to see more care of elderly people at home. We're going to see less futile admission to hospital of frail elderly people. We are going to see, and I emphasize that this isn't the primary goal, but it is the inevitable consequence, and this is the great win-win. We're going to see less cost of health care and less waste. How much less? I don't know. It depends how successful we are at advocating for this kind of care.